I'm Belinda Cochrane. I'm a respiratory and sleep physician who practices in Campbelltown Hospital mainly. That's in southwestern Sydney. Now we're talking about coming out from the other side of pneumonia, the recovery phase. It's a difficult one to try and generalise for everybody. It does really depend on your lung disease and how severely affected you are by it. Particularly the fatigue side of things will often take 1 or 2 months before it subsides totally. And maybe that's an overestimate, but if I estimate longer, then people are happy that if they recover quicker. Now, the other parts of pneumonia, it really depends on how sick you've been. And for people with lung disease, I guess the main difference, all of the factors should improve. Your breathing should improve. If that's what was wrong, your temperatures should come down, and that should come back to normal. Your cough and phlegm, that might take a bit longer. And you might, if you're one of the patients with respiratory disease with prominent cough, you'll probably take longer than everyone else. The phlegm may improve quicker than the cough does. So the phlegm might come back to normal more quickly. One thing to be aware of, though, if you have a lung disease, sometimes when you have pneumonia, and particularly if you've got something like COPD, emphysema, fibrosis, pulmonary fibrosis, you may not come back to your baseline quite. Obviously, we'd like everyone to get to their baseline, but sometimes we find that people don't quite get to where they were before. Or if they do, it may actually take quite a few months to get there. So don't be surprised if it takes a bit of time to recover. The question is, how soon can you get back to doing things? How soon can you get back to exercising? It's important, yes, to listen to your body, listen to your breathlessness, and also make sure that you get enough sleep, because it'll probably be your fatigue and breathlessness that are the things that stop you from getting back to your normal activities. However, it's important that you don't just sit down in a chair and do nothing, or lie in a bed and do nothing, because actually inactivity is the enemy of recovery. So you do have to do a little bit of something, not necessarily exercise early on, depending, as I said, guided by your breathlessness and fatigue. But it's important to try and keep moving. If you have not much breathlessness, then at least walking, preferably outside, quite regularly as you can. If you've got a lot of breathlessness even at baseline, just making sure that you're getting up and walking around in the house, so that instead of just incorporating a little bit of activity into your day rather than just sitting down, because muscles that are not used, they decline quite quickly. People with respiratory diseases need their breathing muscles to work. So we don't want you to sit and not give yourself a little bit of stress to the system, which just means for people with severe lung disease, a little bit of walking and incorporating activity into your day. Pneumonia sometimes will resolve completely. And if so, that's good. But it doesn't always resolve completely. It depends a little bit on what sort of underlying lung disease you have, and it depends on what type of germ the infection is. So sometimes pneumonia can heal with scarring and leaves considerable scarring in the lungs. Sometimes it can actually cause what we call necrosis, which means that some of the lung tissue inside where it's been infected can actually break down and end up sort of dissolving and becomes part of your sputum, and so that you end up with cavities or holes in your lungs. So all of those things are possible, but that only happens with certain, usually the bacterial organisms that cause pneumonia. One of the important things is to check whether the pneumonia has resolved or not. And in people with lung disease, we'll often recommend that you have a repeat X-ray, sometimes a CT scan, depending on your individual circumstances and what your doctors might be concerned about, and also depending on your initial X-rays. And we usually recommend, for the chest X-ray at least, to be about 6 to 8 weeks' time. Why do we look at X-rays and follow up to make sure that the pneumonia has gone? Well, one of the reasons is because we look for an underlying cause. It may be that there's some sort of structural abnormality that we don't know about already in your lungs that has caused the pneumonia. Some of you will have already had pneumonia and will be wondering, okay, I've had pneumonia. Do I still need to have a vaccination against pneumonia? Well, the short answer is yes. We still recommend it because, firstly, the pneumococcal vaccination is actually not a vaccination against every single type of pneumonia. So if you've had pneumonia, it may not have been the one that this vaccine is directed against. As I mentioned at the beginning, we have all sorts of different types of pneumonia. So that's part of the reason that we recommend. And we do know that it is effective in reducing severe infections, including severe pneumonias from this type of bacteria. That's why we do recommend vaccinations, because the one thing I would say about pneumonia in people who have lung diseases is that it's better if you don't have to go through it.